Hello, my name is Melanie Holwell. This presentation is for subject NS3882, Assessment 5. During one of my student placements in a surgical ward, I observed my preceptor-registered nurse provide compassionate person-centred care to a post-operative patient who required multiple dressing changes to be carried out during the shift. The patient was recovering from a long and complex surgical procedure and had been experiencing outbreaks of acute pain in the previous days, which had caused them great distress. Although their pain was effectively controlled on this day, the patient was visibly anxious about the prospect of acute pain returning during the change of dressings. The nurse approached the patient with warmth and communicated with empathy and person-centeredness. They explained the task clearly, actively involved the patient in the planning, were respectful of their autonomy, and addressed the patient's pain concern. Care was taken to preserve the patient's dignity and privacy through appropriate measures, while supporting their emotional needs, which helped alleviate the patient's distress. Management of time was a consideration, however, the nurse ensured that the patient's comfort and safety were prioritised, which facilitated trust in the competence of the nurse and resulted in a positive experience for the patient. This episode of care led me to feel great empathy for the patient and a deep respect for the calm and compassionate approach displayed by the nurse. It was clear that the well thought out care given supported the patient in feeling less anxious. I was also inspired by the genuine human connection that had been created, which was well balanced with their expert clinical skills. This reinforced how impactful these qualities can be when a patient is both physically and emotionally vulnerable. This experience encouraged me to also display those same qualities while assisting the nurse, and through reflection, I evaluated how I might enhance my own skills in empathy and thoughtfulness to build genuine connections in my future nursing practice. Evaluating this episode of care signified that the nurse's conduct had a positive impact on the patient and my own professional learning. Their calm and respectful delivery of patient-centred communication improved the patient's experience through collaborative planning and ensuring that the patient's dignity and privacy were maintained. While addressing the patient's pain concern with appropriate means, their anxiety reduced and they developed trust in the process. From my perspective, the nurse modelled emotional intelligence and empathy and demonstrated ethical sensitivity to the patient's needs, which contributed to the delivery of safe and effective care. Notably, this confirmed for me that clinical outcomes are not achieved through technical skill alone, but are greatly influenced by the quality of interpersonal engagement as well. The nurse's approach reassured the patient and highlights that compassionate communication in patient care is essential for improved outcomes. Analysing this episode of care highlighted the integral role of therapeutic communication when underpinned by emotional intelligence and respect for one's autonomy, which are foundational to providing person-centred, evidence-based care. Emotional intelligence enabled the nurse to interpret and respond to the patient's needs. The nurse demonstrated professional standard behaviours through effective communication and respect for dignity and autonomy, which are particularly reflected in Standard 2 of the RN Standards for Practice, as well as Standards 2 and 5 of the National Safety and Quality Health Service Standards, where collaborative planning and addressing concerns of pain ensured the minimisation of patient harm. The nurse's ability to engage with the patient collaboratively demonstrated how nursing practice that aligns with professional standards promotes positive patient outcomes. This alignment validates the importance of integrating standards-based practice into routine nursing care as a framework for person-centred care delivery. Being respectful of the patient's emotional needs and acting to preserve their dignity and comfort showed key ethical obligations were upheld. Specifically, these actions were in alignment with Code 1 of the Code of Ethics, which emphasises the importance of valuing dignity and individuality, and Principle 2 of Code of Conduct for Nurses, which advocates for person-centred decision-making. This experience deepened my appreciation for the value of emotional intelligence and therapeutic communication, and while clinical proficiency is a key requirement of the job, connecting emotionally with patients is equally important. Interpersonal skills are pivotal in creating emotional safe spaces for patients. It improves communication and in turn promotes improved outcomes. The nurse demonstrated this balance effectively, showing that clinical and interpersonal competencies must coexist. Reflecting on this episode of Care, where empathy, dignity, collaboration, and respect were incorporated, improved the patient's experience and reinforced that nursing requires a diverse clinical and personal skill set to deliver high quality patient care and embodies positive role model qualities. I recognise that it will take time to develop and craft my nursing practice to reach such competencies. However, this is the type of nurse I aspire to become and will signify to others the role model qualities I have. Following is an action plan I aim to implement in my first year of nursing. As a registered nurse, it would be my responsibility to align my behaviours and actions with professional codes and standards by demonstrating accountability, integrity, empathy, and respect throughout my practice. To achieve this, I will continue developing my clinical and interpersonal skills in the workplace, while endeavouring to strengthen my emotional intelligence through reflective practice that supports my ability to assess and respond to a patient's needs. I will observe and reflect on the behaviours of colleagues and seek guidance from mentors who display positive role modelling qualities. This will begin from day one of my nursing career while I work towards becoming an expert in my field of practice. One evidence-based approach I will incorporate to become an effective role model is through continual engagement in my professional development through reputable sites and organisations, and integrating this into my nursing practice to provide quality care to my patients. This may incorporate undertaking formal education, attending skills and leadership workshops or conferences, or analysing research papers, which are recommended activities by the Nursing and Midwifery Board's Continuing Professional Development Guidelines. An area I am passionate about and intend to pursue as a career path is working in palliative care, so I would specifically study for a graduate certificate in palliative care to start with. In closing, through ongoing clinical and interpersonal practice and continued professional development, I aim to develop my confidence and expertise while aligning myself with professional standards to ensure that I provide safe, quality patient care, which will signify positive role modelling qualities I behold. Thank you for listening.